Kırklareli Health History House. On October 29, 2023, as we celebrated the 100th anniversary of our republic, marking the beginning of the Turkish century, the healthcare community of Kırklareli commemorated the leader of our independence struggle, the founder of our republic, Gazi Mustafa Kemal Ataturk, and his comrades with gratitude. Meanwhile, they experienced a different excitement. The Kırklareli Health History House was inaugurated. The Kırklareli Health History House is intended to be an institution affiliated with the Kırklareli Provincial Health Directorate. It aims to gather, document, preserve, and display the cultural heritage that has witnessed the nearly 100-year-long health history journey of our province. It serves as a repository for instruments that evidence the historical development of our health life, sharing its historical and cultural values with the public. Located on parcel number 34, Block 252, Plot 11 in Yaprakli neighborhood, Central District of our province, this first-degree registered building, owned by the Provincial Special Administration and restored by the Provincial Special Administration, has previously served as a military depot and later as a food depot. The exact construction date of this structure is unknown. This cut-stone structure, an example of civil architecture, was purchased by Mustafa Özbey in 1939. It was donated conditionally to the Kırklareli Governorship Provincial Special Administration on November 24, 2011, by Professor Dr. Gültak Özbey, the daughter of Mustafa Özbey and one of the esteemed scholars our province has produced, to be used for cultural activities. After its restoration by the Provincial Special Administration, it was opened as the Professor Dr. Gültak Özbey Art Gallery on March 9, 2015. The building was requested by the Kırklareli Provincial Health Directorate for exhibiting relevant materials from our old health facilities, collected by the Provincial Health Directorate, to preserve the cultural heritage and contribute to the education of Kırklareli University Faculty of Medicine students. The building was allocated to the Kırklareli Provincial Health Directorate for 20 years, as per the Provincial General Assembly's decision dated April 3, 2023, and numbered 162, to be used as the Kırklareli Health History House. The Kırklareli Health History House aims to strengthen the dialogue between health, society, culture, science, and art, serving as a meeting point for the community through exhibitions and educational events. It also aims to be a lifelong learning center accessible to all individuals in society, a living house. Another goal is to preserve the memories of health personnel who have served in Kırklareli, from midwives and nurses to retired chief physicians and health directors, through materials such as photos, publications, books, medical instruments, diplomas, donated by their first-degree relatives. As a structure intended to continuously grow, expand, and evolve, the Kırklareli Health History House contains nearly 800 objects. Some objects have been donated by the first-degree relatives of health personnel who lived and worked in Kırklareli. These include photographs, books, surgical instruments, a 100-year-old dental drill device, dental sets, gynecological sets, pharmacy materials, birth sets, stethoscopes, doctor bags, clothes, and documents. Other objects were obtained from old healthcare buildings that were planned to be demolished or relocated. These include otoscope and ophthalmoscope sets, water purification devices, microscopes, laboratory equipment, books, magazines, and various materials. On the upper floor of the building, examples of clothing worn by healthcare personnel from the early Republic period to the present day, and some used in the international health community, are exhibited. All items in the inventory have been photographed, measured, and recorded in an inventory book, with donor information and other details included. The Kırklareli Health History House, with a security personnel and a promotional officer assigned by the Provincial Health Directorate, serves on weekdays from 9 to 1600 hours. Additionally, a team responsible for the general operation of the Health History House has been assigned within the Provincial Health Directorate. The Health History House is opened on weekends and public holidays upon request to the Provincial Health Directorate. In the journey of organizing the Kırklareli Health History House, documents obtained from Ottoman archives and Edirne province yearbooks, researched by historian writers from the first quarter of the 19th century onwards, were utilized. While researching the health history of Kırklareli, It was found that it has a vast tangible and intangible heritage that cannot fit into a single house. From the first quarter of the 19th century onwards, Ottoman archives, Edirne province yearbooks, Ministry of Health publications, and research by historian writers revealed many significant figures. These include Kaymakam Reza Bey, chief physician of the Kırklareli Military Hospital, which served successfully for many years; Municipal Dr. Lion Effendi, noted for his successful work against cholera; Dr. Ahmet Hamdi Bey, who meticulously recorded our province's health and social data; Ibrahim Feridun Sisioglu, the first official pharmacist of our province; Dr. Mehmet Fuat Umui, who participated in the national struggle and was one of the founders of the Child Protection Institution; Dr. Hulusi Bayset, who served as assistant chief physician at the Kırklareli Military Hospital and whose name is known in the world literature as Bayset's disease; Dr. Mazhar Osman, considered the founder of modern psychiatry in Turkey, who started his education in Kırklareli due to his father's civil service; and today our distinguished professor of cardiology known internationally, Professor Dr. Gültek Özbey, who was born in Kırklareli and completed part of her education here, never forgetting Kırklareli and many other valuable doctors, nurses, dentists, and pharmacists. Dr. Ahmet Hamdi Bey wrote The Sanitary Social Geography of Turkey, Kırklareli Province in 1925, during his tenure in Kırklareli from 1924 to 1929. This work is significant as an official source meticulously created based on direct examination, tours, observations, and investigations with the information and reports of institutions, not only in the field of health but also regarding the history, geography, education, culture, population, economic structure, health, and social elements of the region. The first determinations were made, guiding the future of the newly established state. This book provides detailed information about the socio-demographic structure and health services of the Republican period. It is stated that the total population of Kırklareli was 79,895 in 1923. There was a 25-bed hospital built by the Special Administration in the Kırklareli city center, with 1 doctor, 2 caregivers, and 1 officer working in the hospital. To handle health affairs in Kırklareli, there was a provincial health director, 2 municipal doctors, 41 pharmacies, 2 private doctors, 16 midwives, 45 barbers, 3 butchers, 2 bone setters, and 2 circumcisers. The hospital building, which opened in 1924 in the city center as the Kırklareli State Hospital, moved to a new building in 1971. The old state hospital opened as a health center in 1958. The stone building, still used as the Health Directorate building since 1965, was used as a dispensary building until 1965. In 1995, along with the Health Directorate building, a 3-story reinforced concrete annex and laboratories were built, and dispensary services began to be provided. Dr. Mehmet Fuat Umui, one of Ataturk's first health directors and the first health director of Kırklareli, served as the chief physician of the building, still serving as the Health Directorate until 1937, used as a hospital and dispensary building. Dr. Mehmet Fuat Umui served as the health director of Kırklareli from 1923 to 1925. He played a leading role in establishing the Child Protection Institution, performing successful health and social service activities in our province during his tenure in Kırklareli. The Child Protection Institution was founded in Ankara on June 30, 1921, under the name Himaye Etful Semiyeti, during the most challenging days of the national struggle, to protect the children left behind by soldiers fighting on the fronts and orphans in the occupied regions of Anatolia. Dr. Mehmet Fuat Umui led the rapidly developing organization during the Republic period. Dr. Mehmet Fuat Umui served as a member of parliament for the Republican People's Party from Kırklareli from 1927 to 1946. Various articles about Dr. Mehmet Fuat Umui can be found in the Health and Social Services magazine. Dr. Hulusi Bayset, 1889 to 1948, started his education in Kırklareli due to his father Ahmet Bayset Efendi's civil service assignment, and continued his education in Istanbul. A dermatology specialist, Dr. Hulusi Bayset served as assistant chief physician at the Kırklareli Military Hospital. He became a professor in 1933 and was appointed director of the Istanbul University Faculty of Medicine Dermatology Clinic. In 1939, he received the title of ordinary professor and continued to serve at the university until his retirement in 1947. Dr. Bayset is known for first describing Bayset's disease in the international scientific community. In the Dermatologische Wochenschrift journal, he described 3 cases characterized by recurrent oral ulcers, genital ulcers, and eye iridocyclitis. Bayset's disease, still commonly seen today, is clinically defined based on Dr. Hulusi Bayset's identification. Dr. Mazhar Osman, 1884–1951, Dr. Mazhar Osman Uzman, is one of the pioneers of Turkish psychiatry. Due to his father Hüseyin Bari Bey's civil service, he began his education in Kırklareli. After graduating from Edirne Military High School in 1898, he entered the military medical school, graduating in 1904 and becoming an assistant at the Topkapı Military Asylum. Sent abroad for education, Mazhar Osman returned to Turkey in 1914 and began working at the Gülhane Military Medical School. In 1919, he was appointed to the Üsküdar Mental and Neurological Diseases Hospital. During his work, he emphasized the need for a large, modern mental hospital instead of the inadequate Topkapı Asylum, and led the establishment of the Bakırköy Mental and Neurological Diseases Hospital in 1927 on Ataturk's orders. The hospital was not only concerned with the medical, but also the occupational and social rehabilitation of patients. Considered the founder of modern psychiatry in Turkey, Mazhar Osman significantly contributed to modernizing mental health services in our country through his work at the Topkapı Asylum and Bakırköy Mental and Neurological Diseases Hospital. In conclusion, the establishment and development of the Kırklareli Health History House is a highly important step in preserving and passing on the historical richness and cultural heritage of our province in the field of health to future generations. This project will serve as a valuable source of knowledge and culture, not only for healthcare workers and medical students, but also for our entire public.